So thanks everybody for being here. I've spent the last 3 years at my WIP, which were my first 3 WIPs ever, talking about chronic pain and decision support for opioids and pain. And today we're going to talk about something totally different. So on behalf of myself and Nir, who's off in Vienna doing fun things in Vienna, we're going to talk about an upcoming application for a T32 training program, a pre-doctoral training program in advanced data analytics for behavioral and social science research. So this is a really interesting opportunity. I have not a lot of experience submitting T32s, so we're open to feedback, looking for your thoughts. We're going to play reviewer here at the end of this talk. I want you to, no holds barred, tell us what we're doing wrong, and in particular, tell us how to do better. So before I get going, thank you to lots of great staff, folks who are helping us out on this application. Katie Allen from Data Corps, and also a PhD student in health policy and management over in the School of Public Health. Katie, I think, founded this RFA for us initially, and then made the mistake of saying she wanted to help. And so she's been helping immensely. Kate Baxter, our grant specialist over in School of Public Health as well. And Amy Frame from the Office of the Vice President for Research, OVPR, I have to stop saying OVCR, is also helping with, as you all know who've done T32s, there's this massive amount of work in putting tables together. And so thank you to many of you out there who I've already asked for tables, and you're probably cursing me or others for that. But we appreciate that, and we can provide help, we can answer questions, trying to make that as easy as possible as we put this proposal together. So, the Indiana University program, pre-doc training program in advanced data analytics for social science research. We welcome your acronyms. I hate titles. I'm not good at them. I don't know if reviewers care about them, but maybe they do. So if you can give us a nice pithy acronym, I still think IU Badass is in here somewhere. That's what jumped out at me. And again, I don't know if reviewers like that or dislike that, but please let me know what you got. And then before I really get going into the meat of what this proposal is going to be all about, let me say already exclusions of people or programs thus far in the emails that we've sent out and the requests we've made are probably due to ignorance or oversight. If you want to be involved and you haven't been asked, come talk to Nir or I, and we'll see how we can get involved. And at the same time, if we've asked you to be involved and you want to run and scream and say no, that's fine too. This is meant to be a big tent, which is Nir's favorite thing to talk about. So we are big tent in this, and we want people to be involved. All right, so this is an RFA from the NIH. Lots of different institutes are involved, soliciting applications for behavioral and social science research pre-doctoral training programs, focusing on innovative computational and/or data science analytic approaches in the social science realm. And so they want to develop this cohort of specialized pre-doc candidates who possess these advanced data science capabilities, and they apply them to increasingly new big data that's socially and behaviorally relevant. So kind of some key background in this as you think about this. This is sort of social science good, biomedical physical science bad, at least for this RFA. They're really saying these T32 applications, these programs are not meant to train more biomedical folks. There are other training programs from the NIH out there for biomedical and physical sciences. This is pre-doctoral trainees in a PhD or equivalent doctoral degree leading to careers in behavioral and social science research. So that's an important sort of frame for you to have, I think, as we think this through. So what does that mean? As you may know, with T32s, a big part of the application and the program success is showing a large cadre of mentors who can support, in this case, pre-doctoral trainees in their development and their advancement. And so the applicants must include mentors from relevant behavioral and social sciences, things like psychology, sociology, econ, and so on, public health. So that's kind of one side. And then they want trainees to be mentored by computational or data science folks, engineering, CS, informatics, and so on. So we're trying to put together and frame up a really nice proposal that says we've got both of these types of mentors. And frankly, I would claim this is exactly what we do in the School of Public Health, in Regenstrief, as health services researchers, as health policy researchers, as people who study healthcare organizations. we were all trained in, and some of us are trained in basic social science, and many of us are using social science methods in sort of day in and day out. It's what we do. So I think we can make a really strong case in our application that we are already doing this sort of intersection of social science and data science in lots of different ways here at IU and Regenstrief. I welcome you to push back on that claim if you think or you have ideas on how we can make that better as we go. But I think our mix is pretty strong. So the overall objective of the application is developing this cohort of pre-doctoral candidates who have these advanced competencies in data analytics. They apply to large, disparate, and linked. We're going to focus on clinical and administrative data, and I'll explain a little bit more why. I'll tell you a little bit more about the kinds of data that NIH is particularly interested in, and things that have implications for health services delivery, healthcare management, and health policy. So that's kind of the overall goal of the application and some of the foundations here. So this is what I would claim are our core competencies. We know about health services research. We know about health policy and management. We know about informatics. And so these are core competencies that we really want to play up in this application. And then in the FOA, they talk about 3 types of data and that they want applicants to focus on one or more of. And I've sort of pulled out some of the key phrases because I think we can make a strong case that we have experience and can train folks in all 3 of these areas, but in particular, looking at administrative records data. Lots of folks around here have worked on claims data, insurance claims of different types. They also call out population level agency databases, data from CMS, data from CDC. This would, in my view, also encompasses, when we start talking about CMS, it's often claims data, but other types of data from these agencies as well. And then they talk about health record data. They talk about intensive or voluminous longitudinal data, such as from health records. And I think obviously that's part and parcel to what we do. So we're going to craft a case that we will train, that we are already training people in using these sorts of data sets, and we will continue to do so at this intersection of social science and informatics. So I think some of the strengths we're aiming to highlight here, and we'd love your feedback on how to highlight other strengths or emphasize these, is training diversity. So Nir in particular, who the current structure is he and I will be multiple PIs on this, and he has a long track record of diverse trainees in healthcare organizations, health policy, research, as well as scholarship in this space, in pre-doctoral training, and sort of the diverse, trying to increase the diverse pipeline of trainees, both in informatics, there's doing some work, as well as in health policy and management. So I think this is something really for us to highlight, as well as our experience and ability to train folks to be interdisciplinary team scientists. As health services researchers, as informatics researchers, we're constantly infusing different disciplines. Again, in this vein of, I think this is what we already do here in the School of Public Health in Regenstrief. We're already bringing disciplines together, these different social science disciplines together with data science. And of course, Regenstrief as a convener of all of this. And then, of course, lots of great work that's going on here from folks in data integration and linkage. It's what we do. We have experience in this, and I think we need to sell that hard. Give you a better sense of the curriculum. So the foundation for the curriculum here is going to be our PhD program in health policy and management that's out of the health policy and management department over in the School of Public Health. So I direct that program, and Nir, as the department chair, he's a former director of a similar program in healthcare organizations and policy. So this program, if you didn't know, ideal for students interested in analytic, methodological, and professional skills to tackle health policy and management challenges. So this PhD program is similar to other programs that are called health services research, health management, health services policy and management. Around the country, they have different names, but as a core discipline in public health, health policy and management, this is our program. And so what do folks do? And so I'll also use this as an opportunity to recruit good students. So those of you who are out there and you want a PhD, consider the PhD in health policy and management. The didactic component of our curriculum, which already exists, students are doing this today. The coursework is in things like organization science, organizational theory, policy research, some general public health, and then a heavy dose of research method skills from design, using observational data, causal inference, a number of statistics courses that we work with folks in biostatistics on, economics courses, econometrics experience, both in-house in our department as well as in the economics department. And so the proposed T32 would take that foundational program, and then what we'd do is we'd create a PhD minor in advanced data analytics for behavioral and social sciences research. So those of you who don't know, it's actually one of the things that I hate the most about IUPUI is all PhD students have to do a minor. And in theory, it's kind of nice, but in practice, it can be difficult to execute. On the other hand, I think it's a perfect mechanism for a T32 application because we can now create new curriculum through this minor mechanism. And we did something very similar with the T15 program in public and population health that's T15 that Brian Dixon and Titus Schleier lead. We did a very similar thing where students get a PhD, pre-docs get a PhD in either epidemiology or health policy and management, and then they do a minor in public and population health informatics. So that this application aims to follow a similar model. We've got our existing PhD curriculum. We'll layer on a PhD in advanced data analytics for behavioral and social sciences, and we're actively working on grabbing the right courses from the School of Informatics, from other departments, as well as the School of Public Health to further train these students in advanced analytics, machine learning, and informatics methods. So I think that will play well with the goals of this FOA. And then, of course, NIH wants us to do responsible conduct of research, so that'll be part of the curriculum. And the other big part of a PhD, as you know, is the dissertation research. And so the dissertation research in health policy management is a novel contribution to policy or organizational research. And of course, layered on that for these T32 trainees would be utilization of advanced data analytic methods. Working on and would love feedback and ideas on how we interdigitate with other T32s on campus, other things going on campus to add additional training experiences for the trainees. So there's lots of really cool things going on campus and with partners at other places. So we envision training and experiences in research replication in the context of administrative data. We have some great colleagues at Ohio State who are putting together big systems for continuously replicating and extending observational studies on administrative data sets. And so it's asking sort of holistically, how do we routinize this kind of analysis of big administrative data? We definitely want to kind of double down on our training in rigor and reproducibility with partners on campus, thinking about causal inference in the context of health record data and claims data and other administrative data. And then I think we want to figure out how we can have training experiences around linking data related to social determinants, social and behavioral data. Makes total sense. And we've got great stuff going on in that space. And then I think the other kind of thing that we want to really draw on and build extra training experiences and research experiences in is around collaboration with health systems, also part and parcel to what we do. So I welcome your other ideas. I think one of the ways to be successful in these T32 applications is, great, we've got curriculum, we have didactic, but what are the other experiences that trainees are getting? And then a key piece of this is also going to be, how do we make this not a one-off, but how do we make it consistent with what's already happening with other T15 and T32s on campus? So these are kind of proposed collaborations. Of course, this is as sort of as principals, Regenstrief and the Fairbanks School of Public Health as the principals here, but we're talking to Peter Emby and Aaron Carroll about how we interdigitate, I use that word again, with the K-12 program that was recently funded. I think a heavy dose of learning health system components into the training will be nice. Our colleagues at The Ohio State University who are doing the research replication on administrative data that I talked to you about, they're going to be involved. Of course, we will work closely with the T15 that Brian and Titus lead and ask how we can gain some efficiencies with that program. Coursework out of other programs on campus like the School of Informatics and Computing, and then the newly named O'Neill School, SPIA, working closely with their health policy group, Coasley Simon and her group of really strong health economists, I think are going to be really helpful in bringing a strong dose of economic social science into this. Okay, so that's kind of an overview, is as much of an overview as we can give in 15, 20 minutes. I want to run through the review criteria on a T32. I'm going to move fast because these are ordered in the things that I feel good about first and the things I feel less good about later. So constructive comments welcome. So training program and environment, I think we do really well here. I sometimes wonder, do we need a stronger bench of pure social scientists? A lot of us are applied social scientists or health services researchers. We're not a traditional powerhouse social science institution, I don't think, when I think about our environment. But on the other hand, I think we have a lot of great elements in our training environment. In terms of the PIs, I probably can't be self-critical, so maybe this is why there's not more weaknesses here. NEAR in particular has a strong track record as a program director and churning out students, and can show a long track record of students being placed in academic institutions, which I think is going to be key. So less concerned here. Preceptors and mentors, and those are people in this room as well as others, we need, and I think we can get, a large group of multidisciplinary mentors who have social science foundations in what they do. One of the things I'd welcome advice from other T32 applicants or PIs is how we deal with junior faculty when we put these applications in. So junior faculty inevitably are going to be part of mentoring teams. They're probably not going to be leading or primary mentors on many, but how we structure an application to both highlight the strengths of having strong junior faculty, but also recognizing that they can't carry this. The NIH isn't going to want junior faculty to carry the mentorship load. And my sense is, I could be wrong, but my sense is that campus-wide we have more experience in postdoc and junior faculty training, which translates to some degree, but we don't have many PhD programs on this particular campus. And so how do we bolster our claim that we can do great pre-doctoral training? So some concerns there, and that kind of relates to potential concerns around training record. How do we bolster our claims that while a relatively young school of public health with a short training history of the health policy management program, if you don't know, the School of Public Health is about 6 years old now, and so therefore our PhD programs are only 6 years old. So we can't show a long track record, at least in our specific program. And then the last review criteria on a T32 is the trainees themselves. And I think we have a challenge here on this campus of attracting large, high quality applicant pools, at least high quality on the metrics that NIH tends to like or traditionalists tend to like. So we have existing program in place and recruitment plans in place. We have a very diverse applicant pool. We don't have just a massive number of high GRE scoring, high GPA applicants looking to come to IUPUI. And so how we frame the application around that is going to be important. So I think, yep, that's my last slide. With that, I'll open it up to questions, comments, feedback. Love to hear what you have to say. Titus.
So as one of your early victims in terms of participating in this, let me ask the first question.
I've been a victim to you many times, so.
Okay. Mutually, I assume. You may have mentioned this. Is this an established program where there's lots of other things, or is this a first-time release of this particular RFA? Because obviously, if you're competing with established training programs, your landscape looks a little bit different than when everybody's in the same place as you, kind of in the startup phase.
It's a first-time program, to my knowledge. Yeah. We're not like with the T15 where we were trying to get into the club. It's not like that. But I guess I have this vision of these like longer-standing PhD programs out there that can show decades of training social scientists. Nicole?
Yeah, my understanding that when these are judged, that they do really look at your pipeline, like your availability to get students onto the depth of the bench and things. Is there a reason why in particular for this you would just pull from the PhD program in health policy and management? Could you not maybe present a few key programs that might feed in, that you might maybe support somebody who's in a different department or even a different school?
Yeah, and so we've had those discussions, and I think it's possible. So they have to be social science programs, and we don't have a ton of those. And then part of it would be what we have to make is reasonably, I think, concise and compelling logistical case then, because every PhD program has, and then when you start across schools especially, has different sub-requirements and things like that. So we could still layer this minor on to any PhD program, conceivably here on campus, maybe even in Bloomington. So we've been trying, that's something we're trying to figure out. And in the T15 program, there's 2 PhD programs involved for the pre-docs, and we've been able to navigate that, but it does layer on a significant amount of administrative complexity when you start crossing the rules and governance of different programs. But it's a good point. David.
So I have a lot of ideas, so I'll try to focus on a couple. And I think first off, it's great that you're pursuing this. I do think it's a nice match to our assets and capabilities, and to build those further. One question I have for clarification is how you're managing or defining or operationalizing analytics. Because, on this campus, there's, multiple places you might find that type of thing. So a lot of analytics takes place through biostatistics, or you mentioned advanced statistics. I think, we're still growing, and what is highly innovative is computer science, machine learning. So how you're incorporating that. You mentioned one of the PIs isn't a lead person in that area, but do you have strong secondary people in mind? So I guess the overall question, how are you defining this analytics space, which is fairly interdisciplinary in itself? So that's the question. And then one helpful thing that we could follow up on later, I don't think we want to talk a lot about how you could include cancer health services research into this, but there is a T32 program in the Cancer Population Sciences program led by Vicki Champion. I'm on the internal board of advisors, and it's fairly interdisciplinary. In the past, we have, not as a rule, but trained a few data scientists. And so, I don't know, is there any kind of synergy or integration with that program? Yep. So I'll stop there and get your thoughts about the analytics piece.
Yeah, so thank you for that. We have Vicki's program on our radar and trying to think of engaging more with her. The other thing we're going to do, I think we're talking to program officers next week. There's lots of institutes that are named on this FOA, and we're trying to understand, are we trying to appeal to one, to all? That's kind of unclear. On the analytics, I think the definition of analytics, or our frame in terms of analytics right now, is stemming from what are the advanced analytic capabilities most valuable to policy and management research. And so using the kinds of data that we often use in research that informs policy and management. And so it will tend more towards advanced, so methods, I think, for integrating interesting data sets, econometrics, advanced causal inference kind of things on observational data. And admittedly, then it's a matter of how do we cobble together what exists on this campus to train students in those things, either through traditional coursework or through other experiences. But I think we're coming at it from that sort of policy and management frame, and then asking what are the analytic methods that are most relevant to that, and then the realities of what exists, because we can't build 15 new courses or even 4 new courses. Rich, did you have your hand up?
I was just going to add on to the multiple institution comments with, Purdue and Bloomington potentially can address both of the, social science and PhD training experience issues that you highlighted. And I think, with David's comment about different definitions of analytics, I'd say Purdue College of Engineering probably has a lot of strength to offer under that kind of broader umbrella of data analytics.
So you're on my list to come talk to, by the way.
I feel like we have talked, but okay.
And I didn't respond to your last email, which is making me feel bad. I agree. And from the Bloomington perspective, we've talked mainly with Kosali and her group. And I think it gets back to Nicole's comment of how do we engage, because there is a broader bench of social science without becoming too diffuse and too spread out. I mean, one of the realities of these kind of applications, right, is there's not a lot of money. All the money goes to the trainees, which is on one hand great, and on the other hand, how do you administer that? and I need help. So we need help as you have advice. We have 1 minute.
I just had a question. So in the FOA, it seems under behavioral and social science, they include anthropology, communication, and psychology, but at the same time, it looks like the objective is more about integrating disparate data sources like administrative databases and EHR, more to inform health policy decision.
Yeah.
How do you address that? I mean, when I first heard, I thought maybe you were thinking about combining, field studies, utilizing anthropological methods, or even in the psychology, like what Rich does, with more, informing what we see in the EHR and administrative databases. Or is that far out?
So I think maybe, yeah, so I think some of the applied human factors engineering kind of stuff like Rich does is definitely in scope. And I don't want to try to hit every social science in this. I don't think that makes sense. And I don't know that, yeah, our strategy is to make the case that many of us are already applied social scientists, some of us trained in psychology, some of us trained in statistics, other sorts of methods, and we're already doing this translation and really just play up our immersion and integration in data and health systems, because I don't know, but I can't imagine there's a ton of places like that around the country that can make that claim of already doing it. I'm envisioning an anthropology department trying to connect better to data and systems through this application, and so I think we got to play to our strengths is the bottom line, and mitigate our weaknesses. So I'm taking your time, Nicole. And there's another question in the back.
Given that, though, I mean, and maybe I missed it, would you consider also, when you talked about, I think you mentioned experiential as part of the curriculum, would you expand, did you say that, or did I make that up? Would you consider going outside of the university and having Management Performance Hub be a partner?
Good idea. Yep.
I also think there's some folks at the Kelley School of Business that would be interested in collaborating, so I'm happy to talk with you.
Yeah, that'd be great. We reached out to a couple Kelley faculty in our request for mentors already, but I would love to hear more about that. Thank you.